Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm in Burrawang in New South Wales in Australia. It's coming up to 10 minutes before 1 o'clock Tuesday afternoon. It gives me great pleasure to welcome to the studio all the way from Toronto, Canada, where it is coming up to 10 minutes before 11 o'clock Monday night. I've got Dr. John Viviano, and he's a dentist now specialising his practice, a practice dedicated to sleep dentistry. And that's a very exciting topic because a lot of dentists don't even have any idea of what sleep dentistry is and how they can help their general patients in a general practice. So, John, welcome to the Ultimate Dental Podcast. Good to have you.
Thank you. Pleasure to be here.
Yeah, lovely. So, John, you were a general dentist for the first part of your career, which was a long part, but we were talking just before hitting the record button about the benefits of having a practice dedicated totally to sleep, not just for your patients who you see, but also for yourself as a dentist and making dentistry less stressful. So tell us about that journey and how you came from general dentistry to then grow the sleep side of your practice and then transition to a totally dedicated sleep dentistry practice.
Well, the story I often talk about is when I first got introduced to dental sleep medicine. It was a Tuesday night, and my patient, female, was talking to me about her husband's snoring and how it was driving her nuts, and she was contemplating divorce. It was so stressful in the household. And I had a syringe in my hand, and I was just simply being compassionate, listening, but going in one ear out the other. And all I could think is, can you please stop talking so I could freeze you and go do my hygiene checks and get back in here to do your MODVL on your 3-7 and get on with my night because I'm already behind. How can I help you with your snoring? That was my level of interest. This was a Tuesday night. It's about 7:30. I'll always remember that. That Friday, I was at a cosmetic dentistry course because I'm a dentist, and we were about making teeth looking beautiful and function well and so forth. I was there to hone my trade and learn how to become a better dentist. And out in the trade hall where the different labs and companies had their tables set up, there was a table set up for one of the labs, and there was a sign on the wall behind them, big block bold letters, snoring. And I saw it from a distance and I said, that's crazy. And I walked up to the table and I met Joanne Friedman for the first time, which is still with that company. And I've known her now for approaching 30 years. This was 1996. And I asked her, what can we do for snoring? And she showed me 3 appliances, handed me a couple of papers, and went on to talk to the other customers that she had at the booth there. And I went back to my seat and instead of listening to the lecture, I read the papers, went home, read everything I could find on the internet over the weekend. And by Monday, I showed up at my office with a little trifold pamphlet that I had displayed at my front desk advertising a 1-hour evening seminar for my patients as to how I could help them with their snoring and sleep apnea. Everything that I read and watched videos and so forth online, I was blown away that we could impact in our patients' lives so profoundly, not only with helping to manage snoring, which can be very disruptive in households and marriages and so forth, but also helping to manage breathing related sleep disorders like sleep apnea and upper airway resistance syndrome, which of course have all sorts of medical comorbidities associated with them, which are typically managed with continuous positive airway pressure or CPAP. But back then, and it's not much different to today, although it works well, CPAP, patients have a lot of difficulty wearing it. And so as a result, if they're not offered the alternative of an oral appliance, they oftentimes are left unmanaged altogether and they're left to suffer. They have a shortened lifespan and a reduced quality of life. And that's not even touching on the aspect of the snoring disrupting their relationships and causing stress in the household and so forth. So that's how my journey began. I went from complete disinterest and lack of any knowledge or awareness to, my gosh, I want to get involved in this. I want to do this. And of course, that was the beginning of my learning journey. And I took all the education I could get. It was all coming from the States at that time, and didn't stop reading or learning about it, and continued on my journey. And at this point, I have an office that is dedicated to practicing dental sleep medicine. That's the only service we provide. And there's a 30-seat continuing education center where we teach dentists how to do this and how to implement this into their practice. And that's what I spend my time doing and have been since 2017, when I finally sold my general practice and committed myself to this practice that was dedicated to dental sleep.
John, that's a great journey. When you started that with that brochure, that Monday morning, and you basically were interviewing your existing patients, I guess, do you have any sleep problems in your household? Because everybody supposedly has other people, children even, who snore. What was the result in terms of that, in terms of the uptake of interest from patients or spouses of future patients, in terms of saying, there is a snoring problem in my
Yeah.
house?
So at the time, I had a fairly busy general practice with 4 hygienists, and so there was a lot of turnover of patients regularly coming through their recare system. So we went through a journey of training the staff and everything about how to screen, what to watch, questions to ask. Initially, there was some resistance on their part. I can't ask them if they snore. I can't talk to them about it because it's an embarrassing thing for them to get involved in. Now, a lot more awareness. So with passage of time, they became more comfortable with it. And of course, we uncovered a lot of people that needed our help within the practice. So that's where I recommend people start if they want to get involved in this. Start off by just creating awareness within your dental practice, putting up signs, posters, that talk about, do you snore? Do you wake up feeling fatigued? I mean, there's all sorts of these posters available online that you can just buy, put in a little frame, put up in your office, and those can be talking points. I had one of these types of posters in each of the hygiene rooms so that when the patient's sitting there with the hygienist for an hour or 45 minutes or whatever length of time they're sitting there, if there's and when there's an opportunity to talk about that, that can happen because there's a talking point there sitting right on the wall. Right. Last time I was in, I saw that. My husband's snoring is driving me nuts. Maybe we should set up a consultation with Dr. Viviano. There's an opportunity, to have a touch point there, and very easy to set up a little quick screening questionnaire if it's the patient themselves that's sitting in the room rather than the spouse, where they can very quickly they can self-screen themselves, just by answering some questions, and the score ends up, saying there's a high risk of there being some level of breathing related sleep disorder or not. So that would warrant further evaluation. Of course, physician needs to be involved. So you have a physician referral take place. And then once they have a diagnosis, and an oral appliance becomes one of the options that the patient can entertain. Now, if they go there with some knowledge of what that oral appliance is, now when they're facing that sleep specialist and the sleep specialist says, well, you stop breathing 30 times an hour, you need to wear this CPAP machine. They already have this knowledge because they've had a little chat about this before they even go, what happens is they'll say, well, you know what? I spoke with Dr. Viviano about an oral appliance, and I think I would prefer that route rather than wearing the CPAP. Now, it's a standard of care to provide an oral appliance, according to the American Academy of Sleep Medicine, for any severity of sleep apnea, mild, moderate, or severe, if the patient prefers an oral appliance to CPAP. So, there's no reason for that physician to withhold that prescription. Now, I'm not quite sure how applicable those guidelines are in Australia, but I would think that they were probably similar. For instance, in Germany, where they have equal sleep medicine society, they have very similar guidance over there. So I would imagine the guidance in Australia would be similar.
Yeah, we like to think that we're more like Canada and the United States. My question to you, because this is really important for the general dentist who doesn't know much about sleep, and this happened to me back in about 2007, 2008, when I discovered sleep dentistry and just oral appliances as well. It's an opportunity, one, as you mentioned, if they're snoring, and that certainly can be a relationship killer. Divorce because of snoring. That's a very expensive outcome for a problem that can be solved with an oral appliance. But more importantly, as you said, investigating whether they have an airway-related sleep condition, which can be life-shortening. That's the most important thing, I think, and often something that we've got to impress with our patients. Sometimes dentists seem to think that they're panel beaters, teeth panel beaters, and that's it. And they don't consider the long-term effects of a diagnosis that can be life-lengthening, or by not diagnosing and presenting is life-shortening. They miss out on walking their daughter down the aisle, miss out on playing with their grandchildren, miss out on spending their retirement income that they've saved as well. All these things are really, really important lifestyle choices that they're not aware that the dentist is actually helping them to improve their quality of life and their extension of life.
Well, David, I can tell you that was the reason I became immediately fascinated and drawn to this field. It was one thing to help with the snoring. Sure, that would have entertained me, and I have a solution for that. I didn't realize I had. But when I learned how much we can participate in improving the quality of a patient's life and actually lengthen their lifespan by eliminating or reducing the possibilities of stroke, heart attack, diabetes, hypertension, all the things that, take people out earlier than they need to be taken out. And we can play a role in that as a dentist. That was amazing to me. I said, I want to do that. I want to be that dentist that is participating. Patients are so appreciative and so thankful when their appliance is optimally calibrated. It literally changes their lives. This is a very rewarding field to get involved in. And that's what I saw when I did my research over that very short period through that weekend. That's why it impacted me so quickly, that I immediately engaged and researched, okay, where can I go learn about this? While I start recruiting people to come to these courses, I'm going to go start taking courses so that I can learn how to do this, right? And it went from there. So I agree with you, David. That was the biggest reason that I was drawn to this. 1996, 2025, it's quite a few years, and I can tell you that I feel exactly the same way about it now than as I did. The excitement about being involved in this field, so much so that I spend. This is my retirement practice. I spend so much time. I work harder than ever, but it's a joy because I'm working on something that I'm very passionate about. And I love having a room full of dentists and teaching them how to get involved and do this and add this to their practice and hopefully inspiring them to, want to participate on this level. There's still only a small percentage of dentists actually engaged. There's a lot of dabblers because it's within the scope of all dentists to provide an oral appliance to manage sleep apnea. But that doesn't mean that they're doing it correctly, right? There's a lot of dabblers, but the ones that are well trained know how to select the appropriate appliance for a particular set of dentition or a particular situation, what to watch for, know how to optimally calibrate the appliance, know how to deal with the side effects that happen when the appliance isn't seating properly or balanced properly and so forth. It's not rocket science. It's not, something that's difficult to learn, but you need to go through that learning curve to do it properly, and to take optimal care of your patient.
So that's a really important point for my viewers and my listeners, John, because in Australia, as it probably is in Canada, there's a fear for the general dentist that they may actually be doing some harm by pushing the patient into something that is not appropriate for their condition. So they're concerned that if the patient really does have a major sleep disorder, that an appliance is not really the thing that they should be getting. And so you mentioned earlier that everything in Canada is done with a referral to a sleep physician.
So the board certified sleep specialist, which is a physician that's become board certified in sleep, is who we're working with here in Canada. Not sure of the status of that. I imagine they have sleep specialists in Australia as well. The thing is this: sleep apnea is a medical disorder, right? So a physician needs to make that diagnosis. So you always need to run the patient by a physician to make an official diagnosis. And usually, if they're, doing things by the book, they are not just sizing the patient up. They are having a sleep study of some kind done where they have a proper evaluation so that they can make a proper diagnosis and see if there is a sleep apnea and see what severity level we're talking about. Now, I never have a problem with a patient trying CPAP first, because that is still the go-to device that the physicians like to recommend. The issue is that when the patient drops off or does not comply with CPAP, they are often ignored and just abandoned. Well, if you don't want to do what I'm telling you need to do, I can't help you. And then they turn into the next patient because everybody is busy. They're not going to chase this patient here about not wearing their CPAP, right? The issue, and that's the problem. The problem is that unless there's an alternative offered to the patient that they can tolerate and accept, and the patient just drops off, that really should be malpractice. That's where the harm is being done, right? So CPAP, we know, this is not my numbers, but the statistics from the literature show us that 6 months to a year from prescription, 50% drop out of treatment. And by year 5, 83% drop out of treatment, leaving 17% wearing it. Now, to make matters worse and add insult to injury, oftentimes patients that wear CPAP don't wear it all night long. They wear it 4 hours, 5 hours, 6 hours. They're not wearing it through the whole time. Matter of fact, the benchmark to establish that you're CPAP adherent is 4.5 hours over 4 to 5 days a week. So that's how low they have to put the bar in order to end up with people that are compliant to wearing CPAP. Typically, when the patient wears an oral appliance, they're wearing it all night long. Now, this is where, when you compare and contrast, the benefits from oral appliances are similar to the benefit you get from CPAP, because the mean disease alleviation from both therapies is the same. Van der Veken has shown us that with his research from Antwerp. Bottom line is, when you factor in how long the patient wears the therapy, along with how effectively it reduces the apnea, CPAP and oral appliances have a mean disease alleviation of approximately 50%. So they are the same when you look at it from that perspective. When you look at it on the ability to reduce the apnea down to below 5 into the normal range, CPAP will win every day of the week. But when you look at it from the how long will the patient wear it and what's the likelihood of them adhering to it, 90% of patients that get an oral appliance will wear it. So oral appliances win every day of the week. And this is why the mean disease alleviation is the same. So the net result here is that studies evaluating death from stroke or heart attack, reduction in hypertension, improvement in vigilance testing like driver simulation, improvement in sleep architecture, normalizing the sleep architecture like stage 1 sleep, 2 sleep, 3 sleep, and REM sleep, and so forth. All of that. Oral appliances and CPAP always compare very favorably and equal. One is not superior to the other. Where CPAP wins every day of the week is the ability to reduce the apnea, right? The number of events per hour, and of course, the oxygen desaturation. But there's another side to the oxygen desaturation. There's hypoxic burden, right, which takes into consideration the depth of the desaturation along with how often the oxygen is desaturating, how much time they're spent with they spend below that 90% saturation. And oral appliances and CPAP are similar, more similar with that regard. So the net result is that depends on the optics you're looking when you're evaluating these things. Old school thinking, the CPAP wins. It is the best at getting rid of the apnea. It's what should be used first. But we know from the research, mountains of research in this area, to show how comparable oral appliance CPAP are when you take into consideration actual adherence or use of the device, as well as how much it reduces the apnea.
There must also be patients, John, who have both and either even wear both, an oral appliance with the CPAP machine, but also, as you and I know, travel, it's far more convenient to pop an oral appliance in on a plane than to unpack a CPAP machine. And so there's an alternative as well.
Combination therapy, and when I'm saying combination, I mean combining oral appliances and CPAP is a thing. A study was just published earlier this year, and it's called the CHOICE study, where patients were given a choice of CPAP or oral appliance. They had the opportunity to try both through a structured sequence of trials, and they were given both devices to wear, and they could pick and choose which one they're going to wear, right? What they found is that when patients had a choice, actually CPAP adherence improved, oral appliance use was there, that people wore this a certain percentage, that a certain percentage of the time, but the overall net was that more patients were better taken care of when they actually had access to both devices, as opposed to one or the other alone. So patients appreciate having a choice and the ability to use what's convenient for the situation. I'm going fishing with my buddies. We're going to be sleeping 5 in a cabin, or I'm going on vacation, or you're more likely to want to bring your appliance along, right? But, maybe on a regular basis at home, especially if you're out, having a few beers with your buddies, that you're going to have a particularly bad night of sleep. You want to put the most effective device on that is using air pressure to splint that airway open, no matter what the muscles want to do, right? And so you'll probably throw your CPAP on. So, when you have choices and the ability to go this way or that way, depending on what's called for, that's really the optimum. Unfortunately, the world doesn't work that way, that sure, we'll give you both. Like usually there's insurance coverage for one or the other. People are stuck making a choice. And if they choose a CPAP and then they don't wear it, now they have to pay for the appliance out of their pocket. I'm saying typically, this is the burden that patients have to face, financially to be able to get the optimum care.
Yeah, you've raised a really good question there about the choice of financial concern in the instant or living longer, which people do take the stupid answer, and that's just something about human nature. I understand it was the same when Viagra was invented. Was a heart attack, or what Viagra's been used for, and people say, "Oh yeah, I'll take the Viagra. Don't worry about the heart attack." But getting back to an important thing that you just brushed on. Why is there, or what is this connection between alcohol consumption and poor sleep, snoring, sleep apnea? What's the correlation? Why? What's the chemical?
Any central nervous system depressant is going to make your muscles less tonus, and your dilator muscles are what's keeping your airway open. So when they're less tonus, your airway narrows down. A smaller airway is easier to collapse than a larger airway. So if your muscles are less tonus and your airway is shrunk down a bit, the flow of air creates a negative pressure. That negative pressure causes the airway to collapse. Okay, so what happens is when you have a smaller airway, it takes less negative pressure to collapse that airway, so you're more prone to having the apneic events. And the same thing would apply. It applies to weed, and the same thing applies to any other type of muscle relaxant. Any other type of medication that's a central nervous system depressant.
The other condition, which seems to be correlated to snoring and poor sleep as well, is weight. If people can lose weight and they snore less, what's the connection there?
Well, it's exactly the same thing. When you gain weight not just this way, but you
Oh,
gain
yes.
weight this way as well. And you're coaching on the airway becomes smaller. So if we're looking at an obese male and we measure the size of their airway using acoustic pharyngometry or a CAT scan or anything, they have a narrower airway than a non-obese male because the fat deposition has encroached upon the airway inwards, along with their neck being bigger this way here.
That makes a lot of sense to me, and thank you for clearing that up, because I've seen the thin person and the obese person in those body images where the organs in the obese person are smaller because they're competing in space with the extra weight, the fat. So obviously, if they're organs and they shrink, well, certainly space will shrink as well. And I guess that also happens with blood vessels as well. The weight, shrinks the size of the blood vessel or the diameter, and therefore less blood flows. And so weight can be a condition affecting stroke and heart conditions as well. Very interesting. So obviously that question, let's get back to your practice, your general practice. And this is for all dentists in general practice. It must be fairly easy to get used to asking your patients, how do you sleep? Do you snore? Have you ever done anything about it? And then opening up that conversation. Is that how easy it is to take the leap into sleep dentistry?
Well, when I got involved in this, it was kind of the Wild West, right? Wild West, you needed to have a gun to survive because you never know when you might need it to use one. So you didn't really bother with go take lessons on marksmanship. You just got a gun, right? And you started, you were prepared, right? And that's what it was like in '96. So, and then I started my education. I recommend to get a hold of a good source, and there are you have good organizations in Australia that provide dental sleep medicine programs that will teach you as per the guidance and everything, so that you know that you're doing the right things and you're managing the patients well. So I can speak from what's going on here in Canada. So it takes about 30 to 40 hours of CE in order to become competent in this area. Alberta has guidance in place from their college in Alberta, Canada, and their mandatory CE that you have to take before you can provide oral appliances it takes you to around 39 hours or 39, 40 hours. And exactly the same thing as in Quebec. You can't provide an oral appliance unless you've taken that much CE. It's their programs that they've organized and they've put together, but it's ensuring a certain level of competence. Fortunately, province side of Ontario is still the Wild West, and there's no official guidance there. But our programs here in Ontario follow that the protocol of around 40 hours of because that's how long it takes to learn the important stuff you need to know to become well-rounded, right? Certainly you can maybe do easier cases after taking like 20 hours of CE, but if you want to do the complicated cases, patients with medical comorbidities, and so forth, you need to understand the ins and outs and what's appropriate, what's not appropriate, and how to best manage these cases. And that requires about 4. So I'm using that number as a general rule. And I'm sure that if you look into, because there'll be programs that are offered by vendors, right? That are just based on selling you equipment or using a particular appliance. And they'll teach you how to provide this in a day, right? Like a day course. Well, you can't learn how to do this properly in several hours. You can't. You can become aware. You might learn enough to be able to screen and refer, right? And a little bit of dabbling, maybe manage a simple snore type thing. But to do the more sophisticated cases, you really need to have that certain level of education. So that's what I would recommend.
Well, that's interesting you say that because, in Australia, in my practice, what I found was that as I became educated, it was difficult to get my associates to even refer to me because they could just issue a Michigan splint. Oh, you grind your teeth, here, have a splint, have a Band-Aid. And of course, no education at all. Oh yeah, I see wear, here, have a Band-Aid. But there's so much more than just wear facets to what's causing it.
And this is where I mentioned before, there's no shortage of dabblers,
Mm.
right? Because it's within the scope of every dentist. They're licensed to be able to provide this appliance for sleep apnea. That doesn't mean you know what you're doing or you should be doing it. So unless your college in Australia has, guidance in place, this is what's required. Now they've done that in Alberta. They've done that in Quebec. They've not done that in my province in Ontario yet, right? And I'm not clear on whether that's in place in Australia. It should be in place everywhere where there's certain standards before you can provide this. And so my recommendations, of course, are to learn to those standards because I know that that's the safest way to providing the service.
Well, the other thing, John, is that once somebody does learn, they become more confident and more competent. And
No
so
question.
it expands their practice
Right.
in terms of what they do. With that knowledge and that experience comes more proficiency.
Absolutely. Because your conversations go far beyond speaking to the patient. They also involve speaking to the physician. And unless you're confident about what the literature says, what the guidance says, and why something is okay to do or not, you can't have that conversation with the physician because they'll just shut you down and say, no, I want him to wear CPAP, and you don't have anything to hang your hat on. I would have no problem saying to them, I understand that you would like them to wear CPAP, but the patient is resistant. What if they don't wear it? Just walk away. What do you want for them then? Right? Because according to the American Academy of Sleep Medicine, it's a standard of care to provide a prescription for an appliance, regardless of whether it's mild, moderate, or severe sleep apnea. This patient happens to have moderate sleep apnea. So what is the right thing to do here? I would have no problem saying that to a patient with total confidence because I know that's what the literature says. So this is where this is different than practicing general dentistry, where in someone's mouth and you're working in a little space this big. And this is very challenging and very specialized knowledge. Here, it's more like being a physician. You're sitting back and you're having enough information in your head and you're, sharing it when it's appropriate with the physician, with the dentist, the patient to help guide the therapy. Otherwise, it can get off track because it's very common still today in 2025 that a patient ends up in front of a physician that is biased towards using CPAP, insists they use CPAP, and when the patient is resistant, the physician just looks the other way and ignores that patient, and that patient is thankful to walk away. Oh, glad I didn't have to do that. And meanwhile, they're still not helped. And this is what ends up happening. And every dental practice in Australia has patients that are in that situation in their practice. 1/3 of the adult patients in any dental practice in Australia have some level of moderate to severe sleep apnea. Adult patients, I'm talking, say over the age of 40, north of 40. So 1/3 of them. That's quite a substantial number of patients. So that's a lot of conversations that could be taking place between your hygienist and your patients. This is not going to waste a doctor's time because if it's appropriate and there's a little screening that takes literally a minute, determines that there's a need for a consultation, that can be booked at another time to see them on consultation.
You mentioned a questionnaire earlier
Yes,
that you can ask your patients that then make them more aware
right.
that they have a condition that they, as opposed to, oh yeah, I snore, but it doesn't bother me because I'm asleep, which is often the answer that they'll give. But alerting patients to this, but the fact that what you've just told me, that 1/3 of the patients in a practice have a condition that we
No,
can treat
yeah,
without having to market to the great unwashed masses, they're
Right.
there. These are the people that will already trust us as general dentists. And now we can say, well, I've been studying this and it's more common than I thought, and I can help you.
Right. So the 2 questionnaires that are self-administered, in other words, the patient just answers the questions themselves, maybe when they're having the fluoride treatment done and they're just sitting there with a clipboard answering the questions, are the Epworth Sleepiness Scale. This will give you a measure of sleepiness, not
Yes.
likelihood of sleep apnea, but a measure of sleepiness, right? And it's a very easy, quick questionnaire to fill out. And the other one is a stop bang, STOPBANG, stop bang questionnaire. And that one gives you the risk of having sleep apnea, So between those 2 quick questionnaires to fill out and 2 or 3 other little short questions, you have everything you need to screen patients. It could be all completed in about a minute and a half, 2 minutes. And now from that, it could be determined whether that patient needs to have a consultation with a dentist, which will be booked at another time. So that could be filled out while they're waiting for their appointment in the reception area. It could be filled out while they're in the hygiene chair having their fluoride treatment, or whatever works in a particular office.
Could also be a question attached to their
Intake
appointment
question.
SMS that they receive. Before you come
Exactly.
in, do you
Right.
mind answering a couple of questions?
Right.
Exactly. Easy to do. Very easy to do. And as I said, and as you've said, these are patients with these conditions that we just haven't uncovered that they've got, and they don't understand the importance of treating what they think is, it's just a noise. I sleep in a different room, so it doesn't affect anybody in our house anymore. But it does. It affects their physiology. It affects their life expectancy. It affects their quality of life. Big changes can be made.
Yeah, David, I'm going to share something personal here. In 1998, I was at the Sleep-Wake Disorder Conference, which is now a defunct organization, no longer there. And I was at a table clinic, and sleep physicians were walking by, and I was answering questions about oral appliances. And they were all asking me the same questions. They were asking me, what side effects, what do patients feel when they wear these devices that hold their jaw forward, right? And so I went home and I told my wife, I have this appliance made to fit my mouth, but I've never slept with it. I'm going to try wearing it tonight so I can better answer these questions rather than answer based on what I've learned in courses, right? Well, I wore the device and I had the best night's sleep I'd had in years. I had no idea that I had sleep apnea. No idea. Because we acclimatized to feeling a certain way. Well, I put on some weight. I'm not as physical as I used to be. I'm not as active as I used to be. I'm busy with practicing kids and stuff. And this is the way I feel now, but it doesn't have to be. If your sleep is compromised, it's a slow burn usually getting there, and you just acclimatize to feeling that way. And I wore the appliance just to see what it felt like to wear an appliance, and I slept like a log. I woke up in exactly the same position I fell asleep in. It was just unbelievable. And I've been wearing an appliance ever since. That was October 30th of 1998. So coming up in the fall here, it's going to be a full 27 years of me wearing an appliance. Various different appliances over all those years, but and I've tried CPAP as well. I can tolerate wearing CPAP, but I prefer, my preference is to wear an appliance. When you mentioned the weight earlier, my weight has gone up and gone down through my adult life, and my weight is higher. I needed to wear my CPAP to get the ultimate benefit. My weight, lower, I could wear my appliance and I would get, the same benefit, right? So this is something that, once again, that I'm not unique or alone in that situation where weight goes up, goes down. And so your needs change, and CPAP may be more appropriate, or appliance may be, acceptable, or, depending on, that's the number one determining factor, is not the severity so much, but the weight. If the patient has a lot of weight, it's much tougher for the appliance to do the job. The patient can have 120 events per hour, but if they're not carrying a lot of weight, that works in our favor, and it's much easier to get those events down.
Really, really important. John, you mentioned too that the facility that you now have, you have a 30-seat lecture theatre as well.
Yes. Yes.
Tell us about the program. I'm sure you've got a roadmap for the general dentist who joins and has little to no idea of what they want to do and
Right.
how they can then progress with their knowledge to be a better sleep dentist.
Right. So we have an online learning platform, which means you can take, geez, close to 50 hours of continuing education online, just at your pace, right? And they're all pre-recorded. And then we have programs that we teach at the facility where there's 4 different levels, and in the future there will be a 5th level. But the 4 levels is actually up until level 3 is the 40 hours I was talking about before. That makes you fully competent, level 1, 2, and 3. Level 4 is advanced dental sleep medicine. It's another 16 hours. And in the future, there'll be a level 5. But it's broken down into basically the first level is a 6-hour program online. So it's very accessible to anybody. And then the in-class hands-on programs are 16-hour. They're 2-day programs, 8 hours each day. And that's level 2, and then again level 3, and then again level 4. And so we're delivering appliances, we're taking bite registrations, we're scanning teeth, we're experiencing every aspect of the trade, if you will, so that patients, the dentists leave feeling comfortable because they've actually done the procedure, and watched it being done, because everybody's doing it on each other over and over again, different styles of appliances. So they're seeing all these appliances being delivered and the nuances between the different styles of appliances, what to watch for, how to adjust, what, the little tricks to deal with this particular design versus that particular design. So all of this takes time, and this is why you need to have those hours in order to become well-rounded and competent.
Of course you do. And as you mentioned, we're not in the Wild West now, because we're in 2025. There is an onus on us to be educated so that we can do the best that we can for our patients, as opposed to back in the 90s and even before, where it was just make stuff up and keep your fingers crossed. So kudos to you for setting up this facility and this online facility as well. John, if somebody wants to get in touch with you about your courses and doing your online courses, what's the best way?
Okay, I'll answer that question, but I wanted to just add one last little thing about what we were just talking about. Any dentist, it's within their scope of practice and license to be able to provide an oral appliance to manage sleep apnea. But if you're dealing with a patient that's intolerant to CPAP and you provide an appliance because it's just easy to take a bite according to what the lab rep told you to do, and take an impression and throw the appliance in and send them off on their way, and the patient stops wearing the appliance because it's not balanced properly, the patient stops wearing the appliance because they don't have it optimally calibrated, and you really don't know what you should be looking for to optimally calibrate it or test it objectively to make sure it's optimally calibrated. Now that patient's life is going to be compromised, and it's going to be shorter than it needs to be or could be because of your incompetence. So that's what you have to carry around in your conscience if you decide to dabble in this field. We don't have to deal with that with anything else that we do in dentistry, because we're all well trained from our dental schools to do those procedures. But just because it's within our licensure, understand that you're playing with someone's life here. And you need to be competent to be able to know that you've optimized that appliance and you've optimized the fit so that the patient can comfortably wear it. Because if they stop wearing it because of your incompetence, or they stop wearing it because of your inability to optimize the appliance and it does not really give them the help they need, then it's on you, right? So that's what I want dentists to understand, that, take it seriously to learn how to do this properly. And it'll be extremely rewarding every time a patient thanks you.
Mm.
Now, my email is john@drviviano.com. That's drviviano.com. And my website is sddacademy.com. That's Sleep Disorders Dentistry Academy. So sddacademy.com. If you type in Dr. John Viviano on the internet, you'll find multiple ways to get to those websites. I'm also on LinkedIn. So, that's another way to find me. I appreciate the opportunity to speak with you today, David. It's been fun. This is my passion ongoing for many years, and this is what I'm going to be doing in my twilight. I'll leave you with one little story. My initial inspiration, that appliance that I put in my mouth when I discovered that I had sleep apnea, was a silencer. The silencer was developed by a guy named Wayne Ahlstrom. He was my original mentor, the guy that taught me everything from the beginning in 96. He's from British Columbia. I call him every year on his birthday. This past November, I called him, "Hey, Wayne, how you doing? Happy birthday." And he says, "Well, John, I'm 90 this year, so my license is up for renewal again in March, and I don't think I'm going to bother renewing it because I'm tired of taking these CE programs from these young whippersnappers." So this gentleman was continuing to see patients for sleep apnea until the age of 90, into March, like a few months beyond that. And the only reason he didn't bother renewing it is he's not going to take any more CE, and I don't blame him. And so he was an inspiration to me back then in the 96 when I first learned about this, and he's an inspiration to me now because I'm 69. I got a lot of years to go to 90, so I see a lot of years ahead involved in helping these patients with this, and I look forward to it.
Well, John, definitely I can feel your passion. I'm sure the viewers and listeners to this podcast also can feel your passion and the excitement you have about a career, reinventing a career in treating sleep conditions with appliances in your practice. So thank you very much for sharing that, and thanks for being a guest on the Ultimate Dental Podcast. It's been fun.
My pleasure, David. It was a pleasure being here. Thank you so much.
Thank you, John.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.